I've heard with ring bone that they're waiting for like the coffin can fuse. So
Sure, yeah.
when that is that the same type of fusion that you're talking about
Yes.
there? Okay.
Let's
I always thought that it
let's-
was like the actual bones were fusing together.
No, really good point. So ring bone can affect these two joints.
Yeah.
A high ring bone and low ring bone. The reason we call it is it's jewelry. When they get all these extra bone spurs around there, they can kind of form a ring around the joint, and you can feel that from the outside on some of these horses that they're really thick through there. So this is a higher motion joint, meaning it has more movement.
Okay.
This one, the pastern joint, is a low motion joint, meaning it has very little movement. So this one, if they get high ring bone, eventually what can happen is the cartilage pretty much goes bye-bye. And so on x-ray, what you'll see is, that's my upper, we'll get this one. So they might still have cartilage on the outside of the joint, but the inside it's eroded away enough that that's where that bone-on-bone reaction is. If we get to this point in something like a pastern, what you'll probably hear the conversation switch from is let's prevent the degradation of the cartilage to let's accelerate the degradation of the cartilage. So you can do different things. You can do what's called an arthrodesis, where surgically you go in and you scrape out the remaining cartilage, and then you put metal plates kind of on one side or either side that's screwed in all the way across.
Yeah, totally.
And so we're trying to actually completely immobilize that joint.
Right.
Because right now it hurts because of the little movement it has left. If we completely immobilize it, then it doesn't have some of that same instability and pain related.
So
from
when
that.
you get to that point, is that just like pasture soundness, or?
Frequently you're looking
Yeah.
at pasture soundness if you have to do that. There's another way you can try to accelerate the degradation, or a couple ways, and that's by injecting the joint. We know that repeated, frequent steroid injections, especially one called Depomedrol, can cause degradation of the cartilage, but it also causes pain relief. So sometimes these horses, instead of doing this $15,000 surgery that they need to be casted and a bunch of things, you can just do somewhat frequent or close together Depomedrol joint injections and kind of be controlling the pain but accelerate the cartilage injection or the cartilage degradation. You can also do something, you can inject alcohol like Everclear that you would drink into this joint that accelerates that cartilage degradation even more.
Who's the vet that figured that out?
I don't know.
Let's
I'm
just
wondering
inject
what kind of thing it's doing in my stomach.
Don't think about it, Jen. Don't think about it.
So high ring bone, this low motion joint, getting it diffused is typically considered a good thing, or at least typically improve their comfort overall. In a high motion joint, that doesn't work as well because it kind of needs to move more for them to move their leg. So it's not impossible to try to fuse that whole thing, but you don't usually get as good of an outcome, just again because you want that this joint needs to move more. It's doing more of a flex and extend motion. So not as great when this one looks like that with all the cartilage going. You might not be able to get them.
Got it. And then the ring bone you typically see on like toe-in horses more, is that?
Potentially more, yeah, again, because
Okay.
that confirmation just kind of adding more stress.
Okay.
You can have horses that are completely straight that still get ring bone,
Okay.
but a little less common.
Sorry guys, let's
No,
not ask
no,
more
that's a great
questions.
question. No,
So Ollie has on his left hock, I think, is fusing,
Mm-hmm.
and so that's what those hock injections are doing, correct? It is
Yeah.
okay.
Yeah, so the lower hock joints don't have a hock model, but those are low motion joints too. There's, no, their hock is our ankle. So one of the higher joints is this big hinge joint. That's actually one that we don't tend to inject as much or need to inject as much. The lower joints, which are closer to the foot bones themselves, are low motion joints, similar to the pastern, that again are also typically beneficial if they fuse if the arthritis is that bad. Now ideally we can keep the arthritis from getting that bad or they're not trying to fuse, but if they are, yeah, sometimes we'll just notice, hey, they get more comfortable, so it's okay. Hocks are a fairly forgiving joint to have arthritis in.
That's good.
Yeah.
I don't want to be.
Pasterns, honestly, not as forgiving. Like I've had retire quite a few horses, pastern arthritis, especially if you might retire them and they go on to being semi-pasture sound. Maybe if you fused them, they'd be a little more pasture sound, but those horses still usually walk. They just kind of notice a little mechanical change to the way their foot moves if they do that. Okay, so my next question to go over was like, what does the lameness look like in arthritis? And I feel like this is one for me when I'm working up a lameness that is great information for me to get from you guys. So it kind of helps elevate or lower my differentials, my list of like what could be going on based on what you've seen. So typically arthritis might be gradual onset over months or even years. You might notice your horse warms up out of it, so they start a little stiff when you first get them out, but then through the ride they seem more and more smooth. It might even seem like it comes and goes, like some days it's a little off, and other days they seem pretty fine. You might notice it seems worse the day after hard work, so you went to a show for a few days and then they seem more sore for a day or two after that. Or you might not even notice a limp or a lameness for them that sore, but maybe they're just not executing their job as well. Their lead changes are less snappy, or they're something like that. Their lateral movement gets a little harder to do. So sometimes you'll notice that. Occasionally with arthritis, while it's typically gradual onset, sometimes you might notice it one day just seems way worse. And usually for me that's because they've had something like this where they don't bend as well, and then maybe they took a bad step in the pasture or got too bent or did something and that kind of aggravated the whole thing, and so they just seem like way worse. And yeah, if you have a bad knee arthritis and then not to pick on farriers, but say a farrier meanly picks it up really far and holds it up really high and the horse is fighting, that horse is probably going to be more lame for the rest of the day and maybe tomorrow just because it's reacting to it being bent so hard. That's also the basis of why we do flexions, to say, hey, if it's a shorter thing, but if I flex this for 30 seconds or a minute, does that make you more sore? Versus if I were to sit on my knees and kneel for 30 minutes and stand up, I'm gonna hobble off, for at least a minute on this right knee, right? And then often arthritis will be worse on hard ground versus soft because of more concussion. You might notice that it's worse on the inside of the circle. Not necessarily, but frequently with arthritis, it'll be worse on the inside of the circle if you're lunging them. Or just the joint is harder to bend. Again, the knee is a classic example. You go to pick out their feet or hind feet in the hock and they just feel like a little kind of stiff. Usually arthritis that comes from kind of chronic repetitive use is going to be fairly symmetrical left to right. You might have one that's a little worse one day or a little worse on the other side. But very often if we have arthritis in a cycle or a hock on one side, you're probably going to have similar degrees of change on the other side, which is another way that sometimes you don't really notice a head bobbing limp because they might just feel kind of shuffly all around and not like one leg is really jumping out. And also arthritis pain can be masked. So Equiox is something we use very commonly to like mask or reduce, chronic pain from arthritis, the unhelpful chronic pain that can happen with arthritis. Butte can sometimes mask it, right? Versus if you have a torn tendon or something like that, you might make it a little better with Butte, but you're probably not going to mask it, all the way. Yeah, any other questions on what the lameness looks like?
How do you diagnose arthritis in the neck?
So range of motion, I'll often feel range of motion. You can feel for direct bone pain when I'll sometimes press on either side of the neck and see if they react that way. I can't really feel joint effusion in the neck, it's just under enough muscle that I can't really feel it. Sometimes it's a diagnosis that we back into because it seems like the right front lame, but we've either done all the diagnostics that we can on this leg and we haven't found anything that's fixed it. Or maybe it's like, hey, maybe they do have a slight neurologic delay, right? We call those like proprioceptive deficits, where they just seem a little less aware of one leg is, and that might start increasing my suspicion of arthritis in the neck. And then x-rays are pretty standard for screening. Ultrasound can get you a little bit more fine detail on what's going on, and then we'll use that for injecting. But mainly stiffness, weird front end lameness that we can't really figure out, or direct pain on palpation. Yeah. Okay, so my next question was, how do we differ it from other lameness? So, or kind of how does arthritis lameness differ from other lameness? One, arthritis is less likely to be a catastrophic injury that causes like immediate retirement or something like that. So most of the time, if we do a lameness and we find arthritis, like it's not a great word to hear, but from my perspective, it's like, that's okay, we've got lots of options for arthritis, right? Typically, arthritis doesn't require extensive rest to get better from. Like most of the time, if we've got a little arthritis, I'm gonna say, hey, let's do a joint injection or some treatment, and then we're gonna have you keep working, right? Because again, chronic repetitive stress might cause some arthritis. You're not actually really injuring it further, especially if you help knock down some of that inflammation. So we might have you take 3 days or a week off or something, but not like 3 months of rest, something like that. Arthritis also, our goal is typically not to heal it all the way to normal. We can't really do that. Most of our treatment for arthritis is centered at controlling and stopping additional damage. We can't really reverse a whole lot what's happened. The major caveat to kind of reversing it is if we're just at the synovitis phase, where that green layer gets inflamed, but it hasn't caused any of the other problems, and we treat the joint there, the synovitis can go back to normal. We can probably restore that joint to a normal phase. It hasn't truly extended to bone changes yet. It's all just synovitis versus arthritis. So that's a good one that we can sometimes restore all the way to normal. Arthritis may cause or be caused by compensatory pain, right? So if I have chronic bad right hind leg for some injury, maybe that left front over time will just experience a little bit more wear and tear, and maybe develop arthritis secondary to something else. Or vice versa, if our arthritis in this leg, maybe eventually it's going to contribute to arthritis in another leg because of how you're using your body. It's usually characterized by more chronic pain, especially if it's been happening longer, and that is the pain that's unhelpful, right? That's the pain that let's do something to mask it because it hurts, but it's not doing your body any favors that it hurts. It's not protecting you really, it just hurts, right? So that's the kind of pain that we want to target in arthritis. It's typically not recommended to confine horses with arthritis unless you're at a really end stage phase where they're at risk of hurting themselves. But just like in people, walking, movement, mobility is good for arthritis health. As I'll get into, we have tons of treatment options, but it can become, in some cases, refractory to all treatment. The knee, again, is a great example. They might start to get arthritis here. We might have some treatment options initially that seem to help. Maybe you get a year of good pain relief the first time, maybe you get 9 months the second time, and then over the course of years, maybe you're only getting 3 months of help after a joint injection. It happens in people too, right? Where joint injections become less useful. In humans, eventually you do a joint replacement, right? We're not doing that in horses, so sometimes it can become where it doesn't matter what we do, we just don't really affect the lameness anymore. Most of the time that's going to be your older horses or something that started out as a really traumatic injury that happens. And then in our senior horses, this is a very common cause of mobility issues and quality of life decline, as it just either affects a lot of joints or gets to those end stage points. So going back to the synovitis and how that's treatable, earlier intervention for things that might likely cause arthritis is better than waiting for a problem and then trying to see what we can do. As I said, most of our treatment is at preventing further damage, not really reversing what's happened. So yeah, my next thing is what is the prognosis? So I'm gonna roll it nicely. So I guess kind of reiterating some stuff too. Synovitis or early, mild, adult onset arthritis typically has a good prognosis. Again, if I see that on a lameness and this is a 10-year-old horse, I'm gonna say like, great, we've got options. They didn't blow a suspensory, like we can work with this and keep going. If you do have the acute trauma or the infection, you're more likely to have an intermediate prognosis. A lot of times we can do a lot of good for those horses, like with a joint infection, but they might need to go to surgery to get it flushed out and do some pretty aggressive treatment to make sure we get everything clean there as quickly as possible. Or if it's a really bad injury, of course, there's a lot of things that can be affected between soft tissue and arthritis itself, so that one can just vary a lot. And then, as I mentioned, that end-stage arthritis, that's really advanced, that was never treated and it can barely move, and now you're asking me to treat it for the first time, the knee that can barely pick up, like we might get some help, but it's probably got a poor prognosis at that point, as far as getting them really comfortable. So my next question is, how do we diagnose it? We've talked about this a little bit, so mainly the history helps me a lot on these, like what have you guys been feeling, you know, what's been going on, how long has the lameness been going on, when do you notice it the most? The palpation, so the static exam is really important. You'll see us go through and like feel a bunch of stuff as we're doing the exams. You can, sometimes when they have synovitis, you can feel that effusion, it feels like a bubble of fluid. Some joints are really good at puffing up, others stay pretty small even if they are arthritis. Pastern, not really gonna have much effusion, joint effusion, the swelling that you can feel. Coffin though, you can feel more. Stifle is a great one that you can feel joint effusion on. Carpus you can. The lower hock joints, again, because they're low motion, they just don't really have a big capsule, you just can't feel much of that swelling. But if you've ever heard of something like bog spavin, that's like an old horseman's term that refers to swelling in the upper hock joint. Sometimes horses can have bog spavin and be completely sound. They have swelling in the joint, but it's not associated with pain, degradation, decreased range of motion. Why they get it, who knows. They can also have something called bone spavin, which is that swelling plus pain. So you might hear both of those terms. Similarly, you might hear something like wind puffs. Like, oh, your horse has wind puffs, it goes down a little bit with exercise, kind of symmetrical, left to right on the hind legs, you know, fairly common. Usually that's in the tendon sheath, which is not really a joint, but it's a synovial structure, and the fetlock kind of down low. Again, I see that a lot in horses that are working well, traveling well, not really, doesn't really seem to be associated with pain of any kind, like a true synovitis. That might be a horse that I say, let's try Adequan. You know, like let's do something that kind of helps, maybe an oral joint supplement or something like that, but we're not really going in there with needles at that point.
Have you ever seen wind puffs actually go down?
No, often no.
Okay.
I mean, often
I only
so,
ask
yeah,
because
no.
all of my adult
Yeah.
horses I've had as an adult have had them
Yeah.
and they never go
Yeah.
away.
So in my experience, often when you have wind puffs that have been going on for a while, that joint capsule kind of stretches,
Okay.
and then it's kind of a potential space at this point, so it just fills up with fluid.
Yeah.
And it's not necessarily inflammatory, it's just kind of there.
And do you think that's prevalent, like in the jumping horses, simply because of the stress on their?
I mean,
okay.
it's probably because those horses get boxed solid more.
Okay.
I don't see wind puffs as much on horses that are on 24-hour turnout.
Interesting.
I think what happens is they get a little bit inflamed from work, right? Then they stand around in their stall for
And
12
the
hours or
fluid
14
settles.
hours, and it kind of fills, but they're not moving to like
Yeah.
kind of pump that fluid out, and it just sits there kind of stagnant.
Yeah.
Almost like if lymph fluid accumulates with stocking up, you know, kind of like that same vein.
Right.
So I think that's kind of more the case, and why you
Okay.
might see it more in jumpers. Certainly, maybe because of the repetitive use, but
Right.
if it's actually causing trauma, then it's more likely to be a pain response, and rather than this kind of benign wind puff.
Right.
So
Okay.
it can be a tricky thing on pre-purchases because you can feel like a little bit of fluid, and you're like, today they're sound, like I'm, you know, kind of going to assume this is wind puffs and not an indication of something bigger, but it's just one point in time, so it can be hard to tell if
Right.
you haven't contracted really well. What else I have in my notes here? Okay, so palpation of the joint for effusion, thickening itself, we talked about the ring bone, feeling thick. Sometimes you can feel that thick joint capsule or just the soft tissue around it feels kind of thickened. Sometimes you can feel other kind of bone spurs that just make it feel odd. Decreased range of motion is a big one, so it doesn't bend as normal as you think, or the horse just feels a little stiff, or maybe they give you that side eye when you're bending it, like I don't love it. The lameness evaluation is important enough to go through all of that, but watching it move on a circle, maybe hard ground and soft ground, maybe flexing some joints, maybe with a rider on, like there's a bunch of different ways we can evaluate their gait. X-rays, not surprising, kind of gold standard for evaluating arthritis. Sometimes I can be suspicious of arthritis. Take an X-ray, the bones look totally normal, but everything else kind of points to pain coming from that joint. Those are the ones that I'm going to say we're probably dealing with synovitis and not truly arthritis yet, which is an even better candidate to treat at that point, even if the X-rays look okay. And then response to therapy is another one. So a back is a great example of something we can't do a whole lot of diagnostics blocking, you can't really x-ray these that well. You can get the kissing, for the kissing spine, the actual joint you can't x-ray super well. Maybe you can look at it on ultrasound, but if we're suspicious, this might be one where we treat it with an injection and say, hey, did that improve? SI joint is another great example of that one, where I can't really directly feel it, touch it, image it that well, but maybe we're not improving the lameness much by doing a SIFL injection or treating something there, and some of the movement looks like it could be SI. We might just trial treat that and see what happens on response. And then classically, if we have arthritis low down on a leg, we can do what's called a nerve block and help kind of localize exactly where we are. So on a horse that I have coffin joint arthritis on, I might block the nerve down here on the heel or up here at this level at the fetlock, and I kind of numb all of the nerves. And then if the horse becomes sound after that, then great, I know the problem's probably not up here and I'm in the area, and then we can say, okay, let's do that. Or if I'm not 100% sure if lameness is coming from the coffin joint still, I might go in and block that joint specifically. It's gonna have to be another day, because the block I did here last 2 hours. So I have to come back another day, block this joint specifically, and say, hey, did that improve your lameness? That usually to me is a great indication that joint injections are gonna help, because just by numbing the pain that came from directly within the joint, we've improved your lameness. Versus, got a collateral ligament on the side that maybe is all coming from the same direction, but a joint injection is not gonna help because that's a soft tissue injury, right? So those types of things can help. And then less common, but ultrasound could be useful. Ultrasound's more useful for the back. To a certain degree, it's more helpful for the neck. It gives you a little bit more fine detail there. Most of the good x-rays. Any other questions on kind of how to diagnose it? I know it's kind of whirlwind, but
So usually when we're doing like the maintenance, like 1 year flexions and injections, it's for like synovitis if you don't see anything.
yeah, hopefully, yeah, hopefully.
And then when you guys are actually doing the injection, like I remember, like you want a little bit of clear fluid coming out, but not a lot, because then would that indicate it's like swollen?
Yeah, so that's a really good point. So when I go in here later with my needle, we're gonna have this little hub of the needle, right? Getting a little fluid coming out is great confirmation that we're in the right spot, right? That I'm not injecting this expensive thing into, like over here, right? Like I'm in the right spot. Not every joint is really great at having fluid come out. It just depends if they're a little drier or a little whatever. But if some synovial fluid comes out, I want it to look really stringy, right? And kind of thick, kind of like saliva. What I don't want is to put that needle in and have a whole bunch of water shoot halfway across the barn, right? Like really thin, watery. That looks like really unhealthy synovial fluid. And I'm not usually that mad, because hey, we're in the right spot. Like, let's treat it, let's do what we can do, right? But sometimes I'll even let some fluid drip out for a little bit when it seems like it's really kind of pressurized. Now you can try having a swollen joint like a windpuff joint and drain all the fluid out. It's going to fill back up in a day. Like that's not really going to fix it long term. But I sometimes think it's not a terrible idea. Let's replace some of that thin, watery stuff with this, thicker juicy stuff that I'm putting in there, right? Yeah. Let's see. So then, I guess we kind of did this one at the beginning as far as what arthritis looks like, especially on X-ray. The bone spurs is one of the main things we'll see on bone changes, or the collapse of a joint, again, really severe things. Now, I drew kind of a big bone spur here. Sometimes you'll have, the vet might be, oh yeah, look, here's a bone, here's an osteophyte, and then I make for that, or a bone spur, and it's gonna look like that, like really tiny and underwhelming, and you'll be like, really, are you sure? But again, that means already some degree of bone changes happen, so I already know it's a little more advanced than if we see absolutely nothing, and we're still suspicious of the joint.
Are there joints that bone spurs happen in more frequently than others?
Yeah, like lower hock joints are a really
Okay.
common one, pastern joints are a really common one, stifles are some more common. I would say spurs aren't super common to see in the neck, like these actual like pointy things, but in the neck, so you kind of got this facet joint that's coming down. This is a terrible drawing, but what might happen there is just the whole thing just looks kind of bigger. Like it's not really this pointy spur, but the whole thing is kind of just enlarged. And some of that's probably soft tissue, and some of that's probably like bone itself, but yeah, the whole thing just feels big rather than a little spur. Other things that can happen in really unstable joints is eventually some of this capsule can start to mineralize. So it'll start looking like white, totally outside of where the joint would be. So that can happen too. Kind of less common, but it can still happen. What else do we see? So I mentioned also the sclerosis that can occur. So on an x-ray, if they have sclerosis, it'll usually just look like the bone is a really dense white instead of the kind of intermediate gray color. And again, that's usually right under the cartilage layer. Really common to see that in hot ones, where the whole bone just looks a little bit more white. Occasionally too, you can get lucencies. So the same thing that might cause a bone spur might cause a little bit of a lucency next to it. So it looks like the bone is kind of eaten away a little bit. Again, that's mainly because of this imbalance of the osteoblasts that build bone and osteoclasts that cleave it, where it can kind of get a little pitted looking on x-ray. Similarly, just a regular joint margin. So, I mentioned the little spur here. Maybe on this level, it'll just look a little rough. Not really spur-like, but just like a little off, or a little fuzzy kind of on the margins. We talked about the cartilage erosion. Now you can't see cartilage on x-ray, you can just see the absence of it when those bones are touching or like really thin and kind of close together. And then we talked about the decreased viscosity of the joint fluid itself. So that's mainly it. The next one is we're getting into treatment options. So there's so many treatment options for arthritis. One thing I like to point out is the equine science is about 15 years ahead of human science on joint treatment. In a lot of ways, the equine world is leading the way on joint therapies. And that's because we're not doing joint replacements. We don't have that fallback. And it's because we have really expensive, high-dollar 3-year-olds that can start getting arthritis that we try to keep racing for another year. Or $250,000 dressage horses, Grand Prix horses, whatever, that we're trying to keep going. So there's been reason to do some of this research. So I'm going to go through the list and happy to talk about any or all of them in more detail. But the most standard, and you've heard me say it a bunch, is just a joint injection, right? Intra-articular, let's put something in the joint to improve the quality of that fluid. You can do things more systemically too. So some of those might be true pharmaceuticals that we're injecting, OSPOS, we can talk about it more in a second. Or you could do something systemic like a joint supplement, right? So that might be something you feed through to them to affect them, their whole body. Or it might still be something we inject. Adequan and Legend are two injectable kind of joint support versions. The main benefit of doing something injectable versus oral is to make sure the horse absorbs all of it. Horses are really good at eating these expensive supplements and pooping them out and making expensive manure. Not to say they won't absorb some of it and get some benefit.
That was going to be my question.
Yeah.
Do you think the joint supplements actually
So
work?
in human beings,
Yeah.
yes, and I do think oral joint supplements help in horses, but humans, when we eat something, our stomach will absorb most of it when it comes to a joint therapy. Horses, maybe, let's just say 50% on average, like
Okay.
less, right? So they're eating some, they're absorbing some, but probably some of it's passing through. And there's also bajillions of joint supplements
Right.
on the market. For the most part, I believe you get what you pay for. So if you're buying the $30 a month off the shelf at Big R, it's probably $30 not doing as much, right? Versus some of the ones that have more data behind it, they're more expensive, they're, whatever, probably are doing more because they've kind of proven that their ingredients are bioavailable, meaning they are absorbed through the gut, or they do have some data that they actually help, and it doesn't just sound good. So,
Right.
I do think they can help. If it's, you want to do both, fine. If it's, you want to do the thing that's gonna probably help the most, I'd say let's try the injectable. And
Yeah.
often, if you're comparing one of those high-dollar oral supplements to Legend or Adequan over the course of a year,
Right.
you might even be cheaper doing the injectable route.
Totally.
You
Yeah.
know, or at least kind of even
Yeah.
out. So
Which efficacy do you think is better between Legend and Adequan? Do
You know,
think-
another great question. In general, I like it never hurts to do both. So Legend is hyaluronic acid,
Mhm.
right, which is one of the main components of joint fluid, and can help improve that. Adecon is polysulfated glycosaminoglycan, one of like the proteins that sits in the joint and does some good stuff. In my hands, I've had Legend do better for younger horses that aren't in chronic pain.
Okay.
And Adecon do a little bit better for me in older horses that maybe have some bone change, that seem like that it's been a little bit more chronic. Never hurts to do both, but that does get quite pricey. So
Yeah.
usually for me, I might say, okay, what's your age? You know, what kind of level of joint disease are we worried about here? And so in my hands, that's kind of what's worked best.
Okay.
Now, some horses have individual response, right? And you might see almost nothing with Adecon, and great response to Legend, or vice versa. There's also a few others out there now, Zycosan, which used to be called Pentasan, but finally got FDA approved. It's more similar to Adecon, between Legend and Adecon, but some horses do better on Zycosan than Adecon, and I don't always really know why. You know, it might be one more than the other. That's another kind of systemic version. And then some like polyglycan as well, you can do that as an injection. That one is not FDA approved, but has been used for a long time and can respond pretty well. So besides joint injection,